Hi, my name is Paula Blackstein-Hirsch, and this webinar is about the board's role in the quality agenda. Many boards have focused on philanthropy and corporate risk and have historically delegated quality of service delivery to senior leaders. But with all of the scrutiny and justifiable criticism of boards, both private and public sector over the years, we now know that boards are accountable for the quality of service delivery and that this responsibility cannot be delegated. So what is the board's role? The board's role is to define quality or develop a framework for quality and safety. We focus in another of these webinars on a variety of dimensions that could define quality, and I recommend that organizations adopt the 5 dimensions of quality that are included in Ontario's Excellent Care for All Act. A second responsibility is to ensure that the quality plan flows from the organization's strategic plan. Some boards ask, if we don't have a strategic plan, can we actually just start with a quality plan? And the answer is yes. Assuming you have a strategic plan, depending on the organization, the focus on quality can be more or less specific, but at minimum, an organization focused on healthcare should have at least one pillar focused on the quality of service delivery, from which can evolve a full quality plan. A third responsibility is the board's role in defining or identifying quality indicators to monitor on a regular basis. Realistically, these indicators get identified by staff, but it's the board's role to ensure that there's a balanced set of indicators across the dimensions of quality and to ensure that the indicators represent important aspects for the organization and to ensure that the targets stretch the organization sufficiently. Another board responsibility is its monitoring mechanism. So ensuring that results on something like a scorecard are reviewed at least quarterly. Next, it's the role of a board to be actively involved in committee and board agenda design around quality. And in fact, there is research that demonstrates a link between boards being actively engaged in this kind of activity as compared with staff doing all of this, and the actual outcomes for clients. And finally, it's the role of a board to embrace quality and to become quality literate, basically meaning everyone speaking the same language, wanting to do that within the organization, across the CSS sector, and also with colleagues in other sectors so that we can engage collaboratively in quality improvement initiatives and everyone is on the same page. One of the key roles of boards is asking good questions, which we will cover in just a minute. But first, some of the other roles of boards are to understand the organization's current performance and also to think about what is the desirable performance for the organization. That generally is done through benchmarking with other organizations, which isn't always possible in the early days on a quality agenda, but regardless, just reflecting on your current performance and thinking about where you might like to get to as an organization. It's also important for a board to think about or to appreciate the resources required to support quality improvement. Investment of time and money is required. This kind of work cannot be done off the side of a desk. Boards are pretty good at identifying risks and challenges that could impede the achievement of targets. This refers specifically to the risks and challenges inherent in your quality improvement plan. Next, to understand the timeline required for results. Everyone wants results yesterday, but good leadership understands how long it takes to see change in different kinds of measures and to support staff in achieving those results within appropriate timelines. And finally, as I said, one of the key roles of good board members is asking good, challenging questions. 2 important questions that you can think about at any point in time are why and how will we know? For example, why is there a gap between our current and our desired performance? Why are we not on track to achieve our targets on our indicators? Or, how will we know if our service delivery is effective? How will we know if our organization has a strong culture of continuous improvement? And I'm sure that you can think of many other questions that would be started with these two prompts. So let's take a look at some leading practices for embedding QI knowledge and skill at the board level. What I'd like for you to do is to reflect on each of these as they're shown on the screen, and using the downloadable version of the slide deck from the website to circle true or false, basically identifying whether or not these are leading practices the board should follow to support a quality agenda. So let's take a look at the first one. Board members should be recruited using a skills-based matrix, including a skill base that includes process improvement, organizational development, and/or performance measurement and management. Is that a leading practice or not? So, this next slide demonstrates that indeed it is true. Oftentimes, an organization can think about recruiting from the private sector, recruiting people from other healthcare organizations, or even potentially nurturing someone who has an interest in gaining this kind of knowledge through courses and conferences that are available. Even if you don't believe that you have the ability to recruit someone for each of the skill sets that you might be interested in, which wouldn't be solely quality, but you might be looking for people with legal background, with financial background, with philanthropic background. Even if you can't find people for each of these kinds of, to fill each of these kinds of skill sets, it's a good discipline and practice to at least articulate what you believe you need, and then to go out proactively and fill those positions to the extent possible. What I'd also share with you is that organizations that do this and start communicating their desire to fill these kinds of vacancies actually start to act as a bit of a magnet to attract people who want to be on a board that follows leading practice. Let's look at the next leading practice. Only the members of a quality committee need to be educated about and have knowledge about quality improvement and oversight. Do you think that's true or false? So that statement is false. As long as the knowledge is present on the quality committee, it's not necessary to have in-depth knowledge for all board members. However, all board members should have some facility to understand and have a basic level of knowledge about the quality agenda. This is really no different than finance, where there's an expectation generally that all board members have some ability to understand financial statements, but you wouldn't expect all board members to have an in-depth knowledge of finance. Let's look at the next one. The board orientation program should include key organizational practices related to quality and safety. Do you think that's true or false? True. If you have a separate quality committee, I would also suggest that there be a specific orientation for members of your quality committee that would likely include more depth than the information on quality and safety in general that you would include for your full board. Let's take a look at the next one. Board should spend at least as much time, 25%, discussing matters pertinent to the quality of service delivery as they spend discussing finances. True or false? That statement is true. You might wonder where the 25% came from. It's actually a bit arbitrary. It comes from IHI, the Institute for Healthcare Improvement, in their document or their white paper called Getting Boards on Board, and it really was a reaction to many boards focusing solely on finance. They came up with that, and it also depends how you define quality. So this could include discussion about indicators on a scorecard. It could include telling a client's story at the board. It could include a critical incident report, discussion about accreditation. So there are a variety of topics that could fall under this general topic area of quality. Taking a look at the next one, the board should rely on senior management to bring QI expertise to the board because it's impossible to expect board members to have this knowledge. True or false? Well, of course, that is false. We started out the webinar by saying that boards can no longer delegate this responsibility to management. Boards are indeed accountable and responsible for the quality of service delivery. And finally, the last one, there's no evidence that demonstrates that a board's focus on quality makes any difference to client outcomes. True or false? As I think I mentioned earlier, there are some studies, there are at least 3 seminal studies, that associate leading board practice with better outcomes for patients or clients. So, we covered some questions that board members should ask. We talked about how will we know as one of them, or why. There are a set of questions that can be very helpful at the time that you develop your quality plan annually, and then subsequently when you're reviewing the indicators in your scorecard, which should happen at least quarterly. So let's take a look first of all at key questions that board members might ask once a year when developing the quality improvement plan. The key question really is, how good are our services? So if there are benchmarks available, how do we compare to others like us? Either a group of agencies or perhaps 1 or 2 agencies that you know are good comparators for yourself. If you don't have any comparisons, then just thinking about what would a stretch target be from our own baseline? How much of a gap is there between our current and desired performance? Why does the gap exist, and what's our plan to close that gap? And then a slightly different question, how much variation is there among our providers or among our staff? There's a goal usually in quality improvement to try to decrease variation. It's very difficult to demonstrate improvement if current performance varies considerably among different staff fulfilling the same role. So we do try to standardize as part of our efforts in quality improvement, and being able to drill down and look at variation, whether it's across individual staff fulfilling the same role or whether it's across units or divisions within your organization, it's a good thing for senior leaders to drill down on, to take a look at. On this next slide, we review some questions that board members can ask quarterly when reviewing quality indicators included in the quality improvement plan. These questions are focused on, are we getting better? Are we on track to achieve our key quality and safety objectives as articulated through the targets that we set in our quality improvement plan for each of our indicators? And if not, why not? Is the strategy wrong? In other words, are the actions that we're putting in place not actually the right actions to impact a particular metric? Is the strategy insufficient? Generally, we need at least 2 to 3 or more ideas in order to change an outcome. So it may be that staff are just starting into an initiative and there are only 1 or 2 ideas for change that have as of yet been implemented, and so more time is required, or it may be that they're only thinking about 1 or 2 and more are required. Is it not being executed effectively? If we get to the end of the year and only 40% of clients or staff are doing what we said was important to do, we can't expect that an outcome measure will change. And finally, is it too early in the process? It often takes at least 6 months to see an outcome measure impacted, so we can't really expect to see change on an outcome measure much earlier than that. And the final question is, how many clients is that? And you can ask that at any point in time when you're looking at a scorecard, but better yet, actually framing indicators that get to this question. If you have an indicator on your scorecard that is what's a rate, which is basically something like 0.12 falls resulting in injury per month, that's very challenging to actually understand what that means. If you're only looking internally, you don't need a rate like that includes a denominator that would be something like every 1,000 client days, those kinds of rates. All we need is the numerator, something like how many falls resulted in harm last month. If I hear that 3 falls resulted in harm in a particular month, that's much more understandable to me, and I can relate to that. Another set of questions for board members to ask are reflected on this slide. So in the industry, what are the key drivers for operational excellence? What are the intended and unintended consequences of a particular proposal that may be brought forward by management? What are the risks? If only one option is brought forward, asking, are there other options? Another question like the how will we know or why question is a what if. What if we did something a different way? What if we thought about something in a totally different way? And then finally, how will that impact our client outcomes? This relates to things like an operational plan or other things being tabled at the board and thinking about, even if it's not related to quality, it might actually have some unintended impact or consequence, so always having this question at the back of our minds. Some additional factors that can impact organizational quality that the board should consider are reflected on this page. One of these is, how can we ensure continuity of performance excellence through succession planning? As you will know, one of the key roles for a board is succession planning. If as an organization you've spent a lot of time and resource on creating a strong culture of quality, you certainly don't want that eroded or lost through recruitment of an executive director who doesn't have the knowledge or skill and commitment to carry that forward in the future. So it's a question that really ought to be thought about very carefully by a board in thinking about succession planning. With the trend towards shared accountability and cross-sector integration, the board should be thinking about what types of partnership discussions they need to be involved in. So there are all kinds of partnership discussions going on in the sector, whether they be consolidations of agencies, whether it be about the development of lead agencies, or initiatives like HealthLinks. And I'm not suggesting that boards need to be involved in all of these kinds of discussions, but perhaps a conversation about what kinds of partnership arrangements should the board actually be involved in discussing. Another is, what strategies can the board use to better understand the operations without micromanaging? So there are a variety of strategies that organizations can use to allow boards an understanding of the operations so that then board members can reflect on good questions to ask. Strategies like, early on a board member going out on a home visit if the organization provides home visits, or going into an adult day program and watching a group of staff huddle around a board of indicators and having a discussion on that. Having a team working on a quality improvement project come to the board to share how they're doing on the project and sharing results. all of these different ways that can give a deeper dive on operational reflection to the board to allow board members then to ask good questions on the quality agenda. And finally, what tactics can be used to increase the time available at board meetings in order to discuss quality and other strategic matters? Questions like, do you use a consent agenda as a leading practice at board meetings? Do you send out a board package with briefing notes that end with questions posed at a strategic and a generative level? How much time is spent on presentations versus on discussion and dialogue? These are all kinds of questions to think about in order to make space in your board agendas to spend that 25% on the quality agenda. So once a board understands the content that is required in a quality improvement plan using the Health Quality Ontario template, what are the roles and responsibility for the board versus senior leadership? And I'll just share at this point that in another of these webinars, we actually focus on the various components of a quality improvement plan in Ontario. This particular slide focuses on the role. So the first one here under the board's role is to agree on issues or areas for quality agenda priorities. Now, generally speaking, these are brought forward by senior staff, but it is a responsibility of the board to agree on, to say, yes, these are important quality priorities for this organization that we're going to focus on for the next few years. Once those priorities are identified, one of the roles of senior management then is to articulate these aims in a measurable and specific way. SMART is one of those methods for getting a priority area or an aim specific and measurable. And then once those aims are articulated in a way that's specific and measurable, and the reason for doing that is so that you'll know when you've actually achieved those aims, it's then up to senior management to populate the short and long forms that are included in Ontario's Quality Improvement Plan template. Those templates include the measures, the baseline data, aspirational targets, and also what the action plan is that will engage staff, what the process measures are, and what appropriate targets are going to be included for achieving the targets on outcomes. So those are pieces that are all included in the templates, and that's a staff role to populate those forms. Once the quality improvement plan is developed, it's a board responsibility to approve the quality priorities articulated in the SMART way, and to approve the plan. The outcome measures and the targets on outcome measures are two of the key areas that boards should really pay close attention to. And incidentally, as is articulated in the next box, actually it isn't in the next box, but I just wanted to mention that it is an expectation that the chair of a quality committee, if you have one, that the chair of the board and that the executive director of the organization sign off on that quality improvement plan. So part of the approval by the board is signing off on it before it is forwarded to Health Quality Ontario and possibly to your LHIN as well if your LHIN requests it. So the role of senior management in terms of operationalizing it is assigning executive sponsors for each initiative, each project included in the quality plan, regularly monitoring progress, and problem solving and coaching staff to achieve the targets. And then, as we've talked about, on a regular basis, at least quarterly, it's up to the board to regularly monitor progress on the quality plan and ask good strategic questions. So let's take a look at some potential roles for the board in developing and executing the quality improvement plan, and take a look at which of these are appropriate roles for boards or not by indicating whether the statement is true or false. So let's look at the first one. Determine which outcome indicators and what targets should be included on a quality plan. True or false? So I've indicated that that one is false, and you might wonder why, because we did say that outcome indicators and the targets on those indicators are aspects of the quality plan that the board should pay close attention to. But we also indicated on the previous slide that it was the role of boards to agree or approve once they're in the quality plan. It's not up to the board to identify or determine what they ought to be. Once they're in the plan, if the board doesn't think that they cover important aspects of organizational activity, then the board might question why some of them are included or why some that aren't there haven't been included. But it isn't up to the board to actually develop the indicators in the first place. Let's take a look at the next one. Agree on the quality priorities that will drive the content of the quality plan over 2 to 3 years. Is that an appropriate role for the board? True or false? So we've indicated that that one is in fact true, and again the operative word is agree. Senior staff will review a range of inputs and identify key areas of focus for the quality priorities. The board should have a process in place then to identify or to have senior management share with them those priorities and to actually agree on the fact that those should be the focus for the quality agenda for a 2 to 3 year horizon. Looking at the next one, is it the role of a board to approve the final quality plan? True or false? Yes, that statement is indeed true. It's definitely the board's role to approve the final plan. And I would add as well that it's an important signal for staff in the organization to know that the board is involved and behind the quality plan. The next one, sign off on the final plan. True or false? That one is also true, and I indicated earlier on that there was indeed a place on the quality plan for the chair of the quality committee, if you have one, the chair of the board, and the executive director to sign off on the plan. The next one, ensure that there's an executive sponsor assigned to each quality improvement project in the plan. Is that an appropriate role for the board? True or false? That one is false. That role is really very operational in nature. It's a role for senior management. If, however, on your scorecard that you're reviewing on a regular basis, if you're not on track to achieve your targets, the board might ask if this practice has indeed been followed. Is there indeed an executive sponsor that's been assigned to a particular area? The next one, approve the proposed outcome indicators and targets. True or false? Yes, this one is true. It's different than the first one. This is approve, whereas the first one articulated in terms of determining or identifying the indicators and targets. The final one, monitor the results on outcome indicators at least quarterly by reviewing a scorecard and asking good questions. True or false? And yes, that statement is true. It's definitely a key board role in support of the quality agenda. And you'll note that I've mentioned several times reviewing outcome indicators at least quarterly. And that is the case. What I would say is that in reviewing those, we want to see the results articulated monthly, but the board only needs to look at those data points on a quarterly basis because they're not going to change dramatically from quarter to quarter. And that ends the content for this seminar. To summarize, We talked about the board leading by working with senior management to define a framework, i.e. the quality dimensions, to ensure that the quality plan flows from the strategic plan, to agree on or approve the quality indicators, and to monitor those indicators regularly to determine whether you're on track, and to be actively involved in committee and board agenda design, and of course embracing quality in your organization in order to develop a culture of continuous improvement. With a foundation in quality, one of the key roles for a board is asking good questions. And that ends our webinar. So good luck as you work towards embedding these leading practices into your board and potentially your board quality committee.